Hi everybody, welcome to week 13, our final week of content for our Applied Oral Health promotion. This week we are going to be talking about sealants and traumatic dental injuries. So sealants are a procedure that we as hygienists do pretty regularly in a private practice, often done on children but can also be done on adults. You're going to look at the PowerPoint because it has a lot of good information in there that's going to help you in clinic. So remember, this is a clinical procedure that you will be doing next week, so you do need to review all of this content in order to be prepared for next week. Your clinical instructors will not be teaching you the content, they will be demoing the procedure for sealants and expecting that you know the terminology, you have watched the videos, you are familiar with the tray setup for sealants. So please be sure that you do this unit in full. Once you've done that, you'll also be doing a PowerPoint about traumatic dental injuries, which relates to injuries in children, adults, tooth loss, tooth fracturing, and then different types of athletic mouth guards to prevent oral injury, and looking at those. There is a short section on abuse in there as well, which can be a difficult section to look at and read. But as a healthcare professional, it is our obligation to report when we suspect abuse. So please be sure that you do read through that PowerPoint, but if you have any concerns or questions, let me know. So the PowerPoints are there. The ClinPro is a type of sealant that I believe we do still use this in clinic. So the procedure is a small short video here for you to watch. I've included another video of another product. All sealants are pretty similar with how they are applied. However, it's always important to read the manufacturer's instructions because there may be slight differences in application. Also with etching, the same thing. All etch is not necessarily created the same, so you will want to make sure you read and understand how long to etch a tooth and also how long to cure the sealant material that we're using. Georgian College sealant procedure I've included here for you. There is a fact sheet from ODHA, which is a nice thing as well. Can be good for clients, also good for you to read through and understand what sealants are, what types of clients we would use sealants for. And then I've put in a link here for a Quizlet related to our final test, which is next week. It is not an exam per se, so it's short. But it is cumulative, so that meaning there could be questions from the whole semester. However, there will be a bit more on diet, sealants, and trauma because we have not been tested on that yet. It will only be a 1-hour test in class, and I did post this Quizlet to help you with studying. It's a good start, but you will still need to make your own study notes. It will be fully multiple choice. So once you have read the PowerPoints, watched the videos, feel familiar with the procedure in clinic, and then you can then start preparing your notes for studying for next Thursday. Some of you have already done your presentation in clinic for assignment 3, and the rest of you will be doing that this week. I will be posting that schedule by tomorrow. And those of you that still have to present, essentially you will come to the clinic at your assigned time, ready to do an oral self-care session. They are timed because we have limited time to get everybody's done, but just so you know, you want to make your session no more than 7 minutes when you're practicing. If you have any other questions regarding our week, please let me know, and I will see you guys soon.